Level 1, the dream. You're 19 years old. Every time someone asks what you want to become, your answer never changes. A doctor. It sounds simple when you say it, but you have no idea what those words will cost. College begins with impossible expectations. Lecture halls packed with hundreds of students, all convinced they'll wear a white coat one day. Professors don't know your name. Exams are designed to eliminate people, not encourage them. Your first biology test feels like a punch to the stomach. You study harder, then harder again. Late nights become normal. Coffee replaces sleep. Organic chemistry becomes your entire personality. To strengthen your medical school application, you volunteer at a hospital. Most days you're pushing wheelchairs, delivering blankets, or helping visitors find the right room. It doesn't feel glamorous until an elderly patient smiles and quietly thanks you. For the first time, medicine feels real. Years later, you sit in a silent testing center taking the MCAT, the exam that decides whether your dream continues or ends. Applications go out. Rejection letters arrive, one after another. Then finally, an acceptance. You celebrate for one night. The next morning, you realize you're about to spend the next decade becoming someone else's last hope. Level 2, medical student. Medical school wastes no time reminding you how little you know. Every week feels like drinking from a fire hose. Bones, muscles, diseases, medications, thousands of facts that somehow have to fit inside one exhausted brain. Then comes anatomy lab, a silent room, a covered table, your first human donor. Someone chose to give their body so strangers could learn how to save lives. Holding the scalpel feels heavier than expected. The first incision changes something inside you. Medicine is no longer a dream. It's responsibility. Soon classrooms give way to hospitals. You follow experienced physicians through emergency rooms, operating theaters, and intensive care units. Most days you're invisible. Some days you're terrified. Then one afternoon, you witness your first patient die. Monitors fall silent. The room empties. Life continues outside the hospital as if nothing happened. You drive home wondering why nobody teaches students how to process moments like that. Eventually, you're forced to answer the biggest question of your career. What kind of doctor do you want to become? The decision will shape the rest of your life. Level 3, the intern. Graduation finally arrives. You earn the title, doctor. It feels incredible. For exactly one day. Because on your first shift, you realize something every new physician eventually learns. Medical school taught you knowledge. The hospital teaches survival. Your pager never stops. Days blend into nights. Meals become optional. Sleep becomes a luxury. Every patient depends on decisions you're still learning to make. Sometimes you hesitate. Sometimes you make mistakes. Fortunately, experienced residents catch them before patients pay the price. Still, every error stays with you. After one exhausting shift, a patient's daughter stops you in the hallway. She doesn't thank you for saving her mother's life. She thanks you for sitting beside her when she was scared. That moment reminds you medicine isn't only about treating disease. Sometimes it's simply about showing up. Level 4, the resident. Years pass. The fear never disappears. You simply learn how to carry it. Now younger doctors follow you the way you once followed others. They ask questions. You answer. Sometimes confidently. Sometimes while secretly hoping you're right. The responsibility feels enormous. A patient arrives with severe chest pain. Within minutes, you must decide whether it's anxiety or a heart attack. There's rarely enough time to doubt yourself. The hospital slowly becomes your entire world. Birthdays are missed. Vacations are canceled. Relationships quietly fall apart. Friends outside medicine build families while you memorize treatment guidelines and spend another weekend on call. Then one evening, a patient you treated weeks earlier walks back into the hospital. Not because they're sick, because they wanted to thank you in person. For a few seconds, every sacrifice feels worth it. Level 5, the specialist. Residency is over. Most people would finally start their careers. You choose more training instead. A fellowship. Another few years devoted to mastering one tiny corner of medicine. Now you're no longer expected to know everything. You're expected to know one thing better than almost anyone else. Doctors begin calling you for advice. You recognize problems others overlook. Your confidence finally starts matching your experience. Outside the hospital, however, life looks very different. Your college friends own homes. Some have children entering school. You still rent an apartment. Student loans follow you everywhere. Sometimes you wonder if you sacrifice too much. Then a critically ill patient survives because of one decision only you knew how to make. Suddenly, every sleepless night, every exam, every rejection, every impossible shift feels like it led to that single moment. You're no longer chasing the dream. You're becoming the doctor you always hoped to be. But the greatest responsibility is still waiting. Level 6, the attending. The day finally arrives. No supervisor. No senior doctor looking over your shoulder. The final decision is yours. When your phone rings at 2 in the morning, it's because someone believes you have the answer. Patients no longer see a trainee. They see their doctor. You begin building relationships that last for years. Children become adults. Cancer survivors return just to say thank you. Elderly patients trust you with stories they've never told their own families. Not every story has a happy ending. Some nights you replay every decision in your head, wondering if one different choice could have changed everything. Medicine teaches you that perfection doesn't exist. Only responsibility does. The salary is finally enough to pay off debt, buy a home, and enjoy the life you've postponed for so many years. Yet the greatest weight isn't financial. It's knowing every patient places something priceless in your hands. Their trust. And you never stop feeling the pressure that comes with it. Level 7, the leader. Years of experience earn you something unexpected. Leadership. You become the physician younger doctors turn to when they're uncertain. They remind you of yourself, nervous, exhausted, desperate not to make a mistake. Instead of criticizing them, you teach. You remember every mentor who helped you survive. Now it's your turn. Your days become a balance between caring for patients and caring for the people who care for patients. Conflicts, schedules, burnout, training. The job extends far beyond medicine. Then one afternoon, an intern quietly admits they're thinking about quitting. You don't give a speech. You simply listen. Years later, that same intern becomes one of the finest physicians you've ever worked beside. In that moment, you realize saving lives isn't always done with a scalpel. Sometimes it's done with encouragement. Level 8, the chief medical officer. Your office is no longer inside a hospital ward. It's surrounded by meeting rooms. Budgets replace bedside conversations. Policies replace prescriptions. Every decision now affects thousands of patients instead of one. When shortages hit, you decide where resources go. When mistakes happen, you investigate why. When crises strike, every eye turns toward you. Then one day, a disease spreads faster than anyone expected. Hospitals fill beyond capacity. Doctors work until exhaustion. Families wait for news that may never come. You aren't treating one patient anymore. You're protecting an entire healthcare system. The pressure is unimaginable. Yet whenever possible, you still wear your white coat and spend a few hours seeing patients. Because no meeting can replace the reason you became a doctor in the first place. Level 9, the visionary. Your influence reaches beyond a single hospital. Entire healthcare networks now depend on your decisions. You help open new hospitals where communities have none. You improve emergency care. You invest in research that may save lives decades from now. Some choices earn applause. Others draw criticism. Every decision helps someone and disappoints someone else. That's leadership. Medicine has transformed since your first day in college. Artificial intelligence assists diagnosis. Robotic surgery performs operations that once required enormous incisions. Virtual appointments connect doctors and patients across continents. Technology changes. The mission never does. Every patient still hopes for the same thing. Someone who listens. Someone who cares. Someone who refuses to give up. Level 10, the legacy. Eventually, the day comes when you hang up your white coat for the last time. The fabric is faded. The pockets are worn. It carries decades of memories. You attend a retirement ceremony expecting polite applause. Instead, former students fly in from around the country. Some are surgeons. Some are pediatricians. Some lead hospitals of their own. One after another, they tell stories. Not about your awards. Not about your titles. About your kindness. The extra hour you stayed with a frightened family. The lesson that changed their careers. The encouragement they almost forgot receiving. Only then do you understand your greatest achievement. It wasn't becoming an expert. It was inspiring others to become better than you. Weeks later, your daughter calls. She has been accepted into medical school. You smile. You also worry. Because you know exactly what's waiting for her. The sleepless nights. The impossible exams. The heartbreak. The victories. The privilege of standing beside another human being on the worst day of their life. You tell her the truth. This will be the hardest thing you'll ever do. Then you smile again. And it's also the most meaningful. Somewhere, at this very moment, a medical student is nervously holding a scalpel for the first time. An intern is answering their first emergency page. A resident is making a life-changing decision. An attending is comforting a grieving family. The cycle begins again. Different faces, different names. One purpose: to heal, to serve, to give strangers another chance at tomorrow. Because behind every successful treatment, behind every life saved, behind every heartbeat that continues, there's a doctor who once stood exactly where you began. 19 years old, quietly telling the world, "I'm going to become a doctor."